Welcome everybody to our fourth parenting series that HDC has been working on the last 4 months. It's been really a great experience and successful, and we've really enjoyed being able to host these for you guys. I will be the host for the evening, so I will do my best to be checking for questions, checking to see if everybody's hand's raised. If somebody does want to talk, just raise your hand or shoot me a chat, and I'll make it so that you can talk. And if you guys have a time where you open it up for conversation, if anybody has any questions, comments, anything, just let me know, and I will give you guys the ability to be heard on here. I will also be in charge of the PowerPoint, so when you guys need me to change the slide, just say next slide please, and I'll make sure that I change it for you guys. Otherwise, I'm going to turn it over to our ladies who are hosting tonight's event, and I'll let you guys introduce each other and go ahead and get started. I don't know who wants to go first. How about you, Abby? You can go first.
I was just trying to unmute myself. I'm happy to go first. So my name is Abby Lingwall. I'm the program supervisor and a therapist up in the Lake County office out of Two Harbors. I'm not sure how much we're supposed to say, but my background is mostly in children and adolescent mental health. So I'm excited to be here.
Thanks, Abby. My name is Kelly Barton. I am a licensed alcohol and drug counselor. I am currently the program supervisor for the addictions program within HDC. I've been in the field probably around 25 years now. My experience has predominantly been with adults, actually. And so kind of focusing on adolescence is a new experience for me, and certainly an opportunity for me to kind of learn too, as I had to do a little research for this presentation. So that would be me.
I am Crystal. I work with CTSS and Children's Mental Health Case Management out of Fouquet.
Awesome, and I actually guess I didn't say who I was. I just started talking. I'm Jamie Mallory. I'm the director of Carlton and Lake Counties at HDC. All right, so we'll get started. I'll share my screen and get the PowerPoint up for you guys. Can you guys see yourselves also on my screen? Or you can? Okay, I'll put it down then. You guys can go ahead whenever you're ready.
You're good? Okay.
Mm-hmm.
So I will start us off. Jamie, if you could go to the outline slide, I'll just briefly go over kind of the outline for the presentation and what sorts of things we will cover, so what you can expect to hear us chat a little bit about. First, we'll cover just some data and some statistics from an adolescent youth risk behavior study, just about the prevalence of substance use and mental health in youth and adolescents, popular substances used by youth, kind of what to be aware of, what's most popular, most prevalent, warning signs for parents or school staff. I think we focus on parents, obviously, but they're really warning signs that anybody can watch for. So warning signs, prevention, how to be proactive about substance use and mental health, consequences of it, both physically, emotionally, mentally, and then the health impacts as well. Kind of focus on that physical, the physical impacts of substance use. ACEs, we'll talk about a little more in depth, but it is adverse childhood experiences. It was a study that was done many years ago that's been very, very impactful in helping us understand how early childhood experiences impact mental health and substance use as well. We'll talk about how to get connected to services and different resources in our area, and as well as the barriers to getting connected to those, and hopefully how to navigate those barriers. And then there will, of course, be time for questions and discussions at the end. Hopefully we don't talk too long. I don't think we will. You'll have to be patient with us as we were putting together this slide or this PowerPoint. We assigned slide numbers to each other, and then they've been changed multiple times. So there might be a little bit of like, oh, Kelly, this one's yours, or oh, Crystal, this one's yours. So bear with us as we navigate through that. Jamie, you can go to the next slide and I'll give you a task right away. So I want to start by, hopefully, if people feel comfortable sharing what they're wanting to get out of this presentation. Is there something specific that you're hoping to learn or gain insight on? We'll focus on all of these things, of course, but we want to be mindful if there's certain aspects that you want to talk more about or have more questions about, we can certainly be accommodating to that. So maybe give a minute if people feel comfortable raising their hands and just saying what they were hoping to get out of this presentation or what brought them to this presentation tonight. And to not feel any pressure if there isn't something you want to bring up. I just want to make space for that. This isn't like we'll be silent until someone answers, but I want to give enough time if someone does bring something up.
I did. Amy has a question. She raised her hand. I did unmute you, Amy, and I can see a little purple guy.
Oh, well, then that's not my video, but I'm just wanting more information on like the signs and stuff that a person could recognize.
Amy, do you mean signs of substance use, how to recognize when someone might be struggling with substance use or mental health?
Yes, please.
Yeah, great. We'll cover that. Thank you for bringing that up, Amy. Anybody else, Jamie? All right. And certainly throughout this, if you raise your hand, hopefully that pops up for Jamie. You are certainly welcome to ask questions as we go through. Otherwise, like I said, there'll certainly be time for further discussion at the end as well. So.
Yeah, thanks for attending, everybody. Again, my name is Kelly Barton. Tonight it's my hope to give you kind of a general overview of the prevalence of substance use amongst youth. And as Amy had requested, some warning signs to watch out for what some of the influences on youth decision making might be, some consequences related to substance use. To begin with tonight, I'd like to share some statistics with you from a 2015 survey. The survey was conducted on youth that were in grades 9 through 12. And what the study showed is by far that alcohol is the most commonly consumed substance by adolescents. In the past 30 days of the survey, 32.8% of the youth had used alcohol. 10.8% smoked cigarettes in the last 30 days. 10% used tobacco products. 20% had used marijuana. And interestingly, by 2017, there was actually a significant increase in marijuana use because of the adolescent lowered risk perceptions, and I think we probably all can relate to that. with the legalization of marijuana discussions that we've heard on the news, social media, etc. Unfortunately, kind of impacted our youth in a negative way, really, by giving them perhaps a message that, maybe the risks weren't as great as what I was told when I was younger. So we did see an increase in that. 27% of youth mix alcohol with energy drinks. I've seen them do that with coffee shots as well, and which is coffee and energy drinks mixed, gives you like a stimulant type of effect. 2.1% had used heroin, over 5% had used cocaine, 6% of youth had used hallucinogens, so things such as like mushrooms, acid. 9% had used synthetic marijuana. You may have heard this referred to as like spice or K2. And with those types of substances, the effects can be much more intense, unpleasant, and potentially dangerous when you compare it to naturally grown marijuana. I think one of the big increases we're seeing, certainly in our community here, is increase in intake of prescription medications. Excuse me one second. 16.8% had indicated that they took prescription drugs without an actual prescription. Some of these statistics here are really staggering. From 1997 to 2012, we saw a 165% increase in prescription opioid poisoning hospitalizations. We saw 161% increase in heroin hospitalization. And the biggest number by far is a 950% increase in methadone poisoning hospitalization. Some of you may have heard of methadone. Methadone is an opioid medication. It can be prescribed to reduce withdrawal symptoms in people who may be addicted to heroin or other narcotic drugs. It can also be used as a pain reliever, drug addiction detox, and also as a maintenance program, because it's the lesser of two evils, frankly. But with that comes the potential of abuse, and some regulations locally have changed pretty dramatically, I would say, over the last 5 years, where I would say that there's a lot more oversight on it today. It was easily exchanged and things like that previously with different people that were kind of maintaining it, but I think we have seen some better management of that as of late. Products and methods have changed drastically. Traditional cigarette smoking use actually declined, but the use of tobacco has not changed, as e-cigarettes were the most used nicotine delivering product. And 10% of youth in this age group vaped marijuana through e-cigarettes. So that is definitely something that, I don't know, some people may not even know is a thing, but it absolutely is a thing. And so your e-cig that may not seem to be such a significant problem could certainly contain some other substances beyond just typical nicotine. And if in and of itself, there's some differing statistics out there regarding vaping in general, and I think Crystal will kind of speak to that a little bit more. Next slide, please.
The top 3 substances currently used within youth. First topic is alcohol. So some alcohol products that the youth locally are using is beer, wine, liquor, or homemade moonshine. Next slide, please. Some cigarette and tobacco products that are currently used by the youth in the area are vapes, cigarettes, cigars, chewing tobacco, e-cigarettes, clove cigarettes, flavored cigarettes, or water pipes. And I do encourage, if you're not familiar with what any of these products are, to look them up. I know when I first started learning about them, there's a few of them that look like actual pens or actual like USB drives, but they're actually tobacco products. So if it's something you're not familiar with, I do highly encourage you to look them up and so you can see different images of what they do look like. Next slide, please. For marijuana or THC, some products or ways of using this substance is through vaping, infusers, edibles, bongs, pipes, oils, dabs, waxes, or joints or blunts. Currently through our youth, the vapes, infusers, and edibles and the dabs are the highest within within the Cloquet local community. Again, a lot of these products are new. They don't look obvious sometimes, so I would, again, look up each one of these if you're not familiar with them and educate yourself about what they do look like so you know what to watch out for. Next slide, please.
So a participant had asked about some of the warning signs of substance use, and so we'll start to get into that a little bit. I did want to comment that I think our youth are kind of baffling species as it is, because they have a lot going on between, peer pressure, forming their autonomy, and hormonal situations that are going on, and sometimes it's really hard to know exactly what is going on with their kids. In relation to substance use, some of these signs may actually go undetected, as some of these behavioral changes might be mistaken for just what I talked about as a normal part of puberty. Some of the behavioral changes to pay attention to is you may see kids become more withdrawn and less engaged. They may appear to suffer from signs of depression. They can become angry and hostile, or just simply despondent. You might see a reduced academic performance. You might see them skipping classes, slipping grades, things like that. They may have a decrease in a loss of interest of things that they actually enjoyed previously. And so if they used to go out fishing on the weekends, perhaps they're not going fishing as much. If they used to go to dance class ain't cool anymore now that I'm older type thing. You might just see them kind of starting to turn away from some of those things. Next slide, please. You may see they are kind of changing their peer group around a little bit. Some of the old friends that maybe they grew up with until the point of adolescence are just changing, and maybe that person isn't like nearly as cool anymore. So they start to develop different relationships with other kids, and sometimes those kids may even be like identified by parents as less than desirable that you would want your child hanging out with. Maybe there's some signs there that you may see that kind of concern you as a parent, and certainly, that is a real common symptom for kids that are getting involved with substance use. You may also see them sleeping more than usual, or you could actually see a pattern of them not sleeping at all, depending upon the substance. We didn't talk about methamphetamine in the beginning. However, that is certainly a symptom that you will see when there is methamphetamine use, is just a total inability to sleep. They might be breaking rules, as I mentioned, skipping school. They could be experiencing some unusual physical changes, such as weight loss, especially with your stimulants like methamphetamine. Certainly women are susceptible to that as a weight loss plan. We've seen that quite a bit. We see that in adults a lot as well. That is originally kind of how it starts, and it's just simply to lose weight, and it's actually quite effective, and unfortunately can be very damaging in that process. You may see frequent nosebleeds. They might have bloodshot or watery eyes, suddenly walking around with those little tubes of Visine. They could also have shakes or tremors if they were using enough of a particular substance. You may see a change in grooming habits. They might be, more unkept than usual. Maybe they're not showering as frequently. And they can have deteriorating relationships with family and friends. Perhaps they choose friends, again, that appear less than desirable to parental figures. Those are the situations where you hear parents say, oh, I don't want you to hang out with Susie, or, Johnny doesn't seem to be focused on what he needs to, and perhaps he's not a good influence on you, or, you might feel like something isn't quite right, but you don't know the why. Some of the, next slide, please, Jamie. Some of the influences on adolescent decision-making that certainly can play a role in their ability to access it is just the availability of it within our communities, our schools, and our neighborhoods. And certainly substance-using peers can play a huge role in that. Some kids are looking for a place to belong, so they may connect with that type of crowd. And when you're using and you have drugs, when you have alcohol, you become suddenly very popular. And, they're not, with youth, they don't see, actually adults don't either, frankly. They don't really see that the intimate part of relationships is completely lacking, because you really do feel popular and like you're the go-to person and you have what people need. And that can be really attractive to kids that may not have a sense of belonging. And then, of course, certainly peer pressure too. Other kids are doing it and they don't want to appear like, they're afraid or not as cool, that sort of thing. And then there certainly can be things going on in the family environment or extended family, or maybe even amongst people that your kids interact with. The kids could be experiencing some form of violence, physical, emotional, or sexual abuse, mental illness, or their family members may also be using substances and have kind of modeled that as a way of life. And so it doesn't seem wrong, it seems normal to them. And certainly one of the most common things that we see in adulthood, and I don't know the percentage, but you could practically say that it would be in the high percentage of the 90s, I'm sure, where when you start to ask an adult when they started using substances, within a year of that, oftentimes there's a trauma-related event attached to that at the age that they start using. And then developmentally, they often stop growing emotionally at the age that they start using. So untreated trauma can be a huge factor in the use of substance abuse. And it's unfortunate, what we see with our adults is, they never had a safe place to kind of talk about this trauma-related event or series of events, but yet they've seen different providers throughout the years have diagnosed with one thing or the other. And unfortunately, the really important triggering factor never gets addressed at all. So they may receive different diagnoses, they may receive different medications, and just the fact that the trauma-related event is just completely overlooked, and it appears to be a mystery as to why people started using substances in the first place. It certainly isn't in all cases, but there is a lot of prevalence with that particular situation. And then, of course, you have the genetic vulnerability and the personality traits, such as maybe the child has poor impulse control, a high need for excitement, or they may be like adrenaline seekers. They may also just suffer from mental health conditions such as depression or anxiety and ADHD, and they may have beliefs about substance use that drugs and alcohol are harmless. And so people, kids included, they can develop almost this sense of, I'm experiencing this anxiety and this worry and this concern, and they start to kind of develop this idea that there's something out there that can immediately take care of that. And they find that substances kind of suit that purpose in the beginning, and unfortunately it kind of becomes their go-to medicine, so to speak, and then it just becomes habitual and chronic. It is really difficult to tell, though, what's going on with kids, because certainly kids will do a lot of experimenting as well, and that certainly is not unheard of. So not every child that exposes themselves to substances is going to develop an actual addiction. I think what some of us are most fearful of today is a lot of our kids don't even know what they're ingesting. You know, they may receive a Percocet pill, for example, that appears to be a prescription medication that they either receive or buy off of a friend. However, it could have been manufactured in somebody's house, and it's simply just marked inappropriately and could be actually fentanyl or something to that extent. And so a lot of kids don't even know, and frankly adults as well, don't even know what they're ingesting today when they're taking medications that are not actually prescribed by a provider. And that's where we're seeing a lot of these accidental overdoses. And it's a frightening thing that's going on in our communities, and I think it's only increasing. You know, we keep hearing about these things, and you know, what are the answers? I don't know. I think they're doing a lot of things out in the community today that they haven't done thus far. Different organizations are starting to get more involved, and they're like, for instance, the police department is hiring people that specifically may focus on like addiction or drugs in the community. You know, these are resources that they didn't once have, and so we're kind of seeing that pop up in different places. One of the hospitals also hired like an opioid specialist to consult with doctors on medications that were going to be prescribed for people. So, you know, these were things that were absolutely unheard of 10 years ago. And so hopefully that trend will only continue to try and start to curb some of these problems that our kids are suffering from and our adults. Next slide, please, Jamie.
I think that's me, Kelly. Kelly, you touched on a lot of really great points, so thank you for that. And I think you talked a little bit about the role that mental health plays in substance use, especially in youth, which I just want to point out that we'll talk about that as we move through this too. We'll talk more about that, how they kind of work together quite frequently. But first, we'll talk a little bit about prevention and kind of parenting tips, and prevention and intervention as far as on a parental level look very similar, but we will go through and talk about some of that. So next slide, Jamie. So some early on ways to prevent substance use in your home and in your youth is to have, you know, engagement and involvement in your child's life, to really understand what your kids are up to, who are they, you know, who are their friends, and who are they hanging out with and spending time with, what stressors are they experiencing, what are the things that they have difficulties kind of understanding and handling and processing and all of that. And it really gives parents the ability to recognize those changes that Kelly talked about. If you know who their friends are and who they're hanging out with, you can tell when those things change, become, or if you know what their stressors are, you can kind of indicate when those become overwhelming or a little more intense. And you get that way by open communication, being really open and honest, and just asking the questions, and of course limiting, you know, your judgment when, or you know, fighting or kind of working to fight that stigma around this stuff, being really open and understanding, and really trying to best understand what your youth are going through. And then education and awareness, coming to things like this to learn about what's going on in the community, and learn about the substances that are popular in your community and within youth, and just becoming aware that those things are happening. And then also, this is kind of the last one, but also becoming aware of the resources that are out there and the services and supports. And we'll talk more about how to get connected with those, and just being aware of what's out there for, you know, if the time does come that you need that. Creating positive and healthy environments, that comes naturally when there's open communication and the absence of, you know, judgment, and there's empathy and understanding, and just overall open communication about things within your family. Allowing the youth to feel like they can come to you and talk about the tough stuff, and that you're going to help them kind of work through that and understand that. Of course, involvement in after school activities, that doesn't have to be sports, but sports and different clubs. Every school is different in what they offer, but any extracurriculars that they find joy in and can get that kind of sense of purpose and create those healthy relationships is certainly beneficial in preventing substance use. Next slide. We'll these kind of go hand in hand also when we talk about the mental health piece of it. So there'll be a little bit of kind of overlap there, but some of the interventions is, individual and family therapy, getting connected with an, outpatient mental health clinic. And I put the word or in there, but I think it should be and we'll talk a little bit more about that. The importance of family being involved in their youth's kind of treatment and things like that. So, and then children's therapeutic services and supports, which is CTSS in our world. We like to shorten things. And that is kind of building on those things, kind of processed and learned in therapy and being able to practice those skills and practice and utilize those skills in real life situations, as well as children's mental health case management. Early intervention is incredibly important as far as intervention goes and the success rate of that. The earlier you can kind of get a good understanding of what's going on and what's impacting your youth situation, the better the outcome. And so being able to recognize those things early on is incredibly impactful for their kind of recovery and healing. Dual diagnosis treatment, we'll talk about that. What that is, dual diagnosis or co-occurring disorders just simply means that there's substance use problems or concerns as well as mental health concerns. CD treatment is specific chemical dependency treatment, focusing specifically on the substance use treatment. And then dual diagnosis inpatient, where a child would be admitted, inpatient and be there, full days and a very intense or a more intense level of care. Yeah, so kind of the interventions as well, they look, next slide, please, Jamie. The interventions and parenting tips look really similar to prevention. Being open in that communication, limiting that judgment and shame, and really trying to best understand what got them to where they are, what prompted the substance use, how their mental health is playing into that, if that's also present, and just open conversations. Not, I think most youth really appreciate and respond well to the bluntness, maybe that's not the right word, but just the very direct communication and the direct question asking about these things. They're well versed in this stuff. If they're using it, if they're thinking about it, if they're surrounded by it, they're well versed in the language and the things going on. So just being very, very open and honest about it, and being very direct with kind of questioning and talking about it, and then helping them find those healthy coping strategies as well, which therapy and CTSS can do, and as well as finding after school activities or other hobbies or interests to kind of spend time doing, and creating those healthy environments and healthy relationships. And then the importance of families' engagement, the caregivers, siblings' involvement in treatment is really, really impactful on them. It really provides the continuum of care. It provides just a whole level of support and understanding that they can come to you guys as parents, as school staff, as other providers of any kind of services, kind of understanding what they're going through and understanding how to best support them. So if parents can be involved in kind of understanding that, the likelihood of healing and recovery is far better. Next slide, Jamie. So some of the barriers to these services, and this is true for the mental health piece of things as well as substance use treatment. Insurance, I put at the top, and unfortunately, sometimes the services that we have access to are really dictated by insurance or other financial concerns. And so really understanding what your insurance covers, what they don't, understanding your deductibles, and things like that is really important, and unfortunately sometimes dictates what's available for families and youth. And then accessibility to services, what's even available in your area. We'll talk a little bit about the limited substance use treatment for youth in our area. They are out there and they're doing really, really great work. But just understanding what's available and having the resources that are appropriate for your situation in your area can sometimes be a barrier. The complexity of the mental health system and substance use treatment can be really overwhelming and therefore a barrier. Understanding where to even start, what agency, what program, what type of provider is going to be most beneficial for your situation can sometimes be a barrier, because it's incredibly overwhelming at times to kind of know where to start and who to call. So certainly we have a list of resources at the end to kind of start that process if you need, and asking questions of, and explaining your situation and finding out those programs that are going to be most beneficial. Oh, and then it is added on here, just the limited substance use treatment programs specific to adolescents and youth. I think mental health agencies as a whole are shifting towards treating both substance use and mental health together, because we're understanding that it's so prevalent. Their co-occurring disorders are so prevalent that I think we're shifting to a place where mental health agencies are focusing also on substance use. I know HDC is doing that, and I think others are going to follow suit with that for sure. Next slide.
So one of the things, Abby, we actually didn't talk about in preparation of this, but I was thinking about as I sat and listened to you speak is, the importance of extended family, or the importance of aunts and uncles and things like that. And, I have a couple of nephews that, well, I have a lot of nieces and nephews. I have a couple that are younger. And I've always made sure that I had my own special relationship with them. And so that was, taking them to the Y and going swimming with them, and going out for ice cream, and, going out to eat once in a while. And just, I go out of my way to make them feel special just because I love them so much. But the thing that I've kind of seen develop over time is my 11-year-old nephew will often turn to me in times of turmoil, and where these kids may not feel comfortable, even though they have wonderful parents. They may not feel comfortable always directly reporting to things to their parents, but having just that safe place to land, and the importance of that can be just so beneficial for our children. Because it's, my brother and I were on the phone last night gabbing about all this, and the sense of community that we used to have when I was growing up is so different. Like, we intimately knew our neighbors, and I sat on the porch for sunsets of, my neighbor, Florence, and it's just so different today. And our kids are inside a lot, and they don't have access to community centers. And so anytime that we can add an additional support person like that, our kids are only going to reap some wonderful rewards from that in a multitude of ways. And so always keeping that in mind too, that sometimes we as parents aren't going to be the place that, as much as we even provide that opportunity, we might not be the most likely source for them to turn to. So I think that's an important factor to think about.
Kelly, I'm really glad you shared that. Thank you. And I think that's really an important thing to point out to parents, that it's pretty rare that, well, maybe I shouldn't say it's pretty rare, but it's not common that youth and adolescents and teenagers think their parents are the coolest people that they're going to run to all the time. And just developmentally, that's pretty typical. And understanding that it doesn't have to necessarily be them, that they have somebody who they can have that open communication with, that, limited judgment, even if their parents are those people who would be, empathetic and be able to talk through those. There's that piece of that developmental piece of, my parents are just uncool. And
yeah.
So I think that's a great point to bring up. So thank you for bringing that up, Kelly.
Yeah, definitely. So some of the consequences that we may see related to substance use amongst youth can just really be vast and frankly long term, and some of the things that we create today have lasting impacts, and it's unfortunate. You see that a lot with adults too. They start to develop a criminal record, and it's kind of like the consequence that keeps on giving. Yeah, they may serve their little jail stint or what have you, but for the rest of their future, that record's going to haunt them with their employment and going to job interviews. And there's just so many barriers that are related to some of the choices that we make when we're using substances. But in children, we might see again some academic difficulties. There is an increased risk of dropping out of school. You may see that decline in grades, decrease in ambition. They may drop out of extracurricular activities that they once enjoyed. They may have some health-related problems and injuries related to accidents. A lot of these overdoses that we're seeing are certainly not purposeful. They are accidental, and that's not only happening with our youth, it's happening with our adults as well. But kids are at higher risk for sexually transmitted diseases as a direct result of substance use because our inhibitions are lowered and we may not make the best choices. We might not take steps to protect ourselves and perhaps choose partners that we wouldn't ordinarily choose in other circumstances. Some of the consequences related to mental health could be, one of the most debated things I think in this field is what comes first, the depression or the addiction. Um, it's really sometimes hard to say. With chronic alcohol use, you will see two mental health symptoms every time, and that's anxiety and depression. With kids, I think it's a lot more difficult to trying to decipher, what exactly is going on, because again, it's that perfect storm of growing up. There just could be a lot of things, but amongst our kids, we might see an increase in depression, or they may seem withdrawn or indifferent. They are also at increased risk for suicidal thoughts and or unfortunately completion of suicide. They may also have poor peer relationships, because youthful substance users, they sometimes can become alienated, stigmatized by peers that are not into substance use. And so that's where you start to see that classification amongst kids with, that's the burnout crowd and the jocks. I don't know what they call them today. That's what they called them when I was going to school. But that stigma is certainly associated with it. And I remember being a teen myself all those years ago and thinking to myself, all those jocks that were always kind of pointing to the kids that were using substances, they were doing the same thing. They just weren't caught. That was really true in the school that I went to, and it was very prevalent and overlooked because they were an important part of the extracurricular activities such as football and basketball and things like that. And so I don't know, there just seemed to be a lot more overlooking of those types of situations when I was a kid, and I hope that that certainly isn't the case today. I would hope that we have some different consequences in place for identified students that are using substances, such as those types of things. Kids may develop family crises because it certainly can profoundly impact the parents, the grandparents, the siblings, the extended family. There can be a lot of tumultuous things that go on when a child is using substances. They could become involved with the juvenile justice system. They could be, there could be some gang affiliation, especially in some of the bigger inner cities. You're certainly going to see that again, looking for that place of belonging. There could be drug trafficking. Unfortunately, I think we're seeing a lot more trafficking of our youth, in terms of sex trafficking and things like that. I can't really speak to that. I don't know a ton about it, but I know I'm hearing a lot more about those types of things in the news. And unfortunately, we are seeing an increase in homicides. I think we have witnessed quite a few of those things in the news over the last 10 years where the underlying cause could be related to some form of substance use. and with that can create a lot of community fear. And, you know, it's feeling like our neighborhoods are no longer safe and not wanting to do things that we ordinarily did, going out after dark, you know, just kind of being in more of a hypervigilant state. And certainly substance use amongst youth can increase social and economic impacts, and we can have financial losses, and they may, because they may not like get a job when they were 16, like, you know, some kids that aren't using substances are. They may, you know, put a greater demand on the medical system with ER visits and things like that. And so there can be a lot of costs associated with it. And certainly when we start to look at the financial burdens of treatment services, which are not cheap, you know, and even if our insurance companies are paying for it, we're all paying for it in some kind of capacity. So there's a lot of financial impact related to youthful substance use. Next slide, jumping into health impacts actually.
Next slide. So yeah, talking a little bit about the signs of overdose, and these are very specific to, you know, an in the moment overdose that needs, you know, immediate medical attention. But some of these things can also be ongoing problems, you know, physical consequences of substance use as well. But and of course, the signs of overdose, the way individuals respond to any substance varies, of course, on the substance, as well as just from person to person, how their body responds to a certain substance and a certain amount of it. So some of the major signs to, you know, be aware of and, you know, give kind of immediate medical attention to is intense chest pain, any seizuring, of course, difficulty or abnormal breathing, so fast or slow, difficulty breathing, delirium, being kind of confused and not understanding, you know, not being able to hold conversations, not being fully oriented, so not being aware of maybe where you are or who the people are around you. Intense anxiety, so worry and fear, kind of that paranoia and agitation, that psychomotor agitation, so pacing, intense moving, shaking, things like that. Any deviation from a normal body temperature, so that could be, you know, a really high temperature or a really low temperature, and shivering. Unresponsiveness, of course, needs immediate attention, not responding, you know, not waking up, not opening eyes, things like that. Irregular, fast or slow heart rate, so really any change in heart rate is a sign. And then any changes in skin color. It can, you know, be a yellowing, almost jaundice. It can be red based on, you know, increased body temperature, blue, purple for decreased body temperature, but really any change, blotching, itching, things like that. Any change in skin is a sign of overdose. And I don't think there's a separate sign or a slide for this. And Crystal, correct me if I'm wrong, and you are going to talk about this, but some of the, you know, long-lasting health impacts are certainly upper respiratory problems, especially related to that vaping, which we've talked about is incredibly common. Weight changes, compromised immunity, and some of these signs of overdose, the fast heart rate, the difficulty breathing, some of those can be kind of long-lasting after the, you know, the substances or the high has come off or the overdose has been addressed. Some of those things can kind of last, but certainly those upper respiratory concerns are we've seen on the news a lot, I think, and just in the media, and are learning more about it every day, because vaping is kind of very new, so we continue to learn about it. But those upper respiratory and lung people, youth having lungs collapse and things like that, ending up in the hospital due to upper respiratory stuff is quite common. Next slide, Jeannie. Now we're kind of moving into what we've kind of been talking about partially throughout all of this, and it's co-occurring disorders, and it's like Kelly has brought up a lot, that there's often underlying mental health symptoms or mental health diagnosis, mental health concerns going on with substance use. So co-occurring dual diagnosis, I'm trying to think of what else it might be called, but those two are typically how we refer to it. So co-occurring or dual diagnosis simply means that there's substance use problems and concerns, like I said, along with mental health symptoms or mental health problems. And then why is it so common? Kelly touched on this a little bit, so thank you for that little preface. Certainly genetics play a role, like Kelly had mentioned, just your personality traits, what's passed down if there's a history of substance use or mental health in your family. There is a genetic component. Of course, that doesn't account for all of the situations by any means, but it's incredibly common for youth, especially because that decision making is so compromised, to start using substances to cope with some of the mental health symptoms. Feeling really down, depressed, low energy, low motivation, they might turn to those substances for really quick fix and to really kind of boost that motivation and things like that, and then kind of spirals or can spiral from there. Feeling really anxious or agitated or irritable, often kind of turning towards some of those substances to bring that down and feel more relaxed and calm. And that's how you end up with kind of co-occurring disorders. They spiral. They're all very, very addictive. They are a really quick fix to those mental health symptoms, and unfortunately they're very unhealthy and have really long-lasting impacts. So being able to recognize that, certainly if there is anxiety there on fitting in and being part of a certain group and making those social connections, like Kelly said, it's really common to turn to substances to feel a part of that group and belonging. And there's, anxiety might be the underlying factor there, about worrying, that social anxiety piece, about worrying what other people think and how you'll be perceived and how you'll fit in. And what treatment options are available and most effective. We also kind of touched on that a little bit. Addressing both of those together is by far the most effective and beneficial for youth as well as adults. But individual and family therapy, of course, and really focusing on both things, and for both things to be kind of in that treatment plan and be working on them simultaneously is going to be most effective and beneficial. Next slide, we'll kind of go into some mental health specific topics now. So the most common mental health diagnosis among youth is depression, anxiety, and PTSD, which is post-traumatic stress disorder. So some of the signs and symptoms of depression and anxiety and PTSD, I'll go through some of those. Depression, that isolation, that being withdrawn from family, from friends, from extracurriculars, a lack of engagement in that stuff and just pulling away from that is a major indicator that maybe something isn't quite right. Poor academic performance, failing grades, skipping class, things like that as well. Fatigue, feeling extra tired, really low motivation, not kind of finding that joy in the things that they used to get excited about or really enjoy and love, just not getting the excitement out of those things anymore. Engaging in negative self-talk. So, and if they're indicating kind of feelings of worthlessness and sadness or guilt, kind of voicing those things are warning signs or common symptoms of depression. Anxiety, seeing or hearing kind of that intense worry, and there's many different types of anxiety disorders. There's generalized anxiety and social anxiety are the two most common. So generalized anxiety kind of manifests in a way that there's intense worry or fear, anxiousness about really many different things in their lives. Bad things happening, social situations can be part of that, and that really difficult ability to, or difficulties controlling that worry, not being able to stop it, not being able to kind of bring themselves out of that. And then the social anxiety piece is kind of specific to having intense fear and worry about how you're perceived in social situations, intense anxiety and agitation when you're in a room full of people that you don't know. And again, the inability to kind of control that and be able to manage that. PTSD is also one of the most common, and we'll talk kind of more about that as we move into the ACEs study and talk a little bit about that. But that's a strong reaction to a traumatic event, long-term lasting effects of something that something traumatic that a youth or a child experienced, which can be a variety of things from, of course, sexual abuse, physical abuse, neglect, maltreatment. It can also manifest from natural disasters like car accidents and fires and things like that. So, and that also manifests itself and presents itself in a very different way depending on each individual. A lot of times in younger kids and as well as youth and adolescents is, angry outbursts, the irritability, some really important symptoms to kind of monitor and be aware of our intrusive memories, kind of thinking about those things, having those flashbacks, feeling like you're in that moment again, feeling like that traumatic event is happening to you again, even though you are surrounded by safe individuals. And then nightmares, having nightmares either about the traumatic event or a similar experience or situations are very common signs of PTSD. Next slide. Crystal, this is where I got a little bit confused. Are you starting with this or am I?
It doesn't matter either way.
Okay, do you want to take it over?
Sure.
Okay.
All right. ACEs impacts on mental health and substance use. Next slide, please. What is ACEs? So ACEs are adverse childhood experiences, different experiences. In a little bit here, I'll go through and identify some of the questions of what that looks like, but it comes down to abuse, neglect, and life challenges, which I just listed. Sorry, I wasn't even looking at the slide when I was reading that. Next slide, please. How does ACEs impact individuals? So things that you can see is depression, anxiety and PTSD, as Abby just talked about and what that looks like, unplanned pregnancies, sexual transmitted diseases, physical health symptoms. For physical health, that could be heart issues, respiratory issues. Cancer was significant with people who experience higher numbers of ACEs. Alcohol and drug abuse was a lot more prone, especially with the higher numbers, and then education and occupation effects. Next slide, please. Some of the ACEs questions include, and all of these are including before your 18th birthday. So they include, like, did a parent or other adult in your household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt, push, slap, or throw something at you, or ever hit you hard, or have had marks or were injured, touch or fondle you, or have a touch, or you touch their body in a sexual way, or attempt to actually have oral, anal, or vaginal intercourse with you. Next slide, please. 4 and 5, no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support. So really addressing the supportive system within the family dynamics. You didn't have enough to eat, had to wear dirty clothes, or have no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if needed. So for number 5, it's addressing the different aspects of neglect. Next slide, please. 6 and 7, before your 18th birthday, was a biological parent ever lost to you through divorce, abandonment, or other reasons? It could be death, separation. Number 7, was your mother or stepfather often or very, very often pushed, grabbed, slapped, or had something thrown at her, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over a few minutes or threatened with a gun or knife? Next slide. 8, 9, and 10. Did you live with anyone who was a problem drinker, alcoholic, or who used street drugs? Again, environment of any adolescent or youth can impact both mental health and substance abuse. Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison? So these are the 10 questions that are addressed within the ACEs questionnaire. It was originally conducted in 1995 to 1997. There's actually 2 waves that they did collecting data for that. Next slide, please. In 2019, 61% of adults in a CDC study experienced at least 1 ACE score. 16% of adults have experienced 4 or more of those 10 that we identified. Women and racial ethnic minority groups are at greater risk of experiencing higher ACEs. In Minnesota, 60% have experienced at least 2 or more ACEs. 15% in Minnesota were 5 or more. Next slide, please. Services and resources, I believe that's Abby again. Abby, I think you're muted.
Oh my gosh, I should be way past this. Just kind of talking a little bit more about those ACEs and how it impacts our mental health. So those are things that happen in adolescence when our development, our cognitive and physical, emotional development wasn't necessarily there enough to really adequately process and address some of these stressors. And they really have long-lasting impacts. And so, and I think for a long time, we didn't realize how impactful our childhood experiences are on our adult mental health. And these things kind of come out later on in life, which the important part is that they come out and that they get connected with services and resources to kind of process through these things and heal from these traumatic events or adverse experiences. But the earlier that we can identify that these things have happened or are happening, that's that early intervention piece, and healing and recovery become a lot more likely and a lot more effective. So I think just kind of wrapping up here, talking about services and resources and what's available. So Jamie, next slide. We've touched on a lot of these already throughout. So individual therapy, really focusing with that individual, with that youth, kind of what's going on, what came first, the depression or the substance use, what mental health struggles are they having, is there underlying anxiety, were some of these traumatic events present, and kind of processing through those and understanding those, and understanding the impacts they maybe are having on substance use. Family therapy, of course, meeting as a family. The more people that can be involved in that, the better. The bigger the support system, the better, of course. And then day treatment. Day treatment is, these are kind of in maybe service level intensity. So day treatment would be kind of a next level intensity in mental health and substance use treatment. Day treatment would look like your child going to a facility for part of or all of like a school day, and engaging in individual therapy, family therapy, that CTSS that we talked about, that skills work throughout their day, and as well as a lot of them also have an academic component, so they don't miss out on that academic piece and can move through that. Residential treatment would be the next level and one of the highest level of cares available, where your individual would reside at a facility where they are surrounded by trained mental health providers and continue to engage in that intense individual family therapy and skills. And then specific modalities for kind of therapy and treatment. These are trauma-focused cognitive behavioral therapy. So, and then cognitive behavioral therapy on itself. And CBT really focuses on the connection between thoughts, feelings, and behaviors, and being able to control the thoughts and in turn control feelings and behaviors, and understanding how those things work together and what a youth might have control over or be able to gain control over. Trauma-focused CBT really focuses on a traumatic event and kind of changing thoughts, feelings, and behaviors around that. DBT, dialectical behavioral therapy, that's a modality that can be a specific program for someone or a specific service for someone. We can also use DBT skills in kind of traditional individual and family therapy, learning those relaxation, distress tolerance. I'm not trained in them, so I can't list them off super well, but distress tolerance and emotion regulation skills, and being able to practice those in real life situations. EMDR is specific to trauma as well. Eye movement desensitization and reprocessing, I think. And so really focusing on similar to TFCBT, really focusing on a traumatic event and the thoughts and feelings and behaviors associated with that. CTSS, like we talked about, that skills, providing skills training and being able to practice and utilize those skills, and that can happen in an individual, family, and group level, depending on what an agency provides. Children's mental health case management, having a case manager to advocate for these services and help you kind of navigate these systems and get connected with the services that are going to be most beneficial. School-linked mental health services is a grant that HDC has. I'm not sure about, I know a lot of other agencies utilize that as well, but it's a grant that allows all of these services in some way or another to be linked directly to school, to your child's school, so they can get these services throughout their school day. That really allows for care coordination and consultation with school staff, which is equally as important as parental involvement in providing that continuum of care, and really ensuring that everybody in the child's life kind of is able to understand the impacts and best support them through whatever those impacts might be. And then skills for psychological recovery, I just quite recently learned about being provided in Cloquet, and maybe someone else has better insight into this, but I believe it's a several week, like 8-week kind of course to really focus on those skills to heal from, or to manage kind of stress and distress tolerance and any other kind of mental health problems that you might be experiencing. And my understanding also is that it's open to youth, their families, as well as adults. I see a head nod. I'll take it. Next slide. So I'm not sure if people are able to take a screenshot of this, and or if we're able to give this to people to have, but the next 2 slides are resources in the area. The first one is specific to mental health. Of course, I mentioned that the Human Development Center is certainly striving to kind of address both mental health and substance use together, because we definitely see the effectiveness and the importance of that. And some of these other agencies may be moving towards that as well. And I think the next slide is alcohol and substance use specific treatment options in the area. And I think, like we talked about, although I think some of these maybe are in the cities, the Twin Cities area. Unfortunately, one of the barriers is substance use treatment specific for adolescents and youth in our area, but they certainly are out there, and they're doing really, really good work. So, and maybe this list seems overwhelming too, because there's a lot of phone numbers and a lot of things and each one of these operates differently. So being patient with that and understanding, spending time understanding what each agency offers and what might be most beneficial for you and your family. So we will open it up. Oh my gosh, I just looked at the time for the first time. Hopefully that allows for enough time to answer questions and have a discussion if people are wanting to do that. So we'll open it up for that if that works. Jamie?
It looks like Amy has a question.
How do you see
Will we
that?
be able to get a certificate with the total number of hours for all 4 of these trainings?
Yes. Well, you might be able to get a separate one for each training, but we can, we will, if you send an email to the email address that's provided, we can provide you with the certificates.
Thank you.
Yes. Anybody else have any other questions or comments or?
You always want to leave enough time, otherwise they'll close it out and someone will say, I was just going to ask something.
I was going to mention too, like if you don't feel comfortable verbally asking a question, you're more than welcome to use the question and answer box or the chat.
That's great, Crystal. Thanks for saying that.
Well, I just wanted to say I felt like that went very well, very smooth, with lots of very helpful information.
Yeah, I want to thank everybody for attending who's out there. I don't like that I can't see you, but I know that you're there, and so thank you for joining, and know that this is a great kind of first step in understanding and supporting the youth in your life.